It's time now for County-Wide, a presentation of Yavapai Broadcasting News. You'll hear about the interesting issues and happenings that affect all our lives. Here's today's County-Wide.
Good day and welcome to the program. It is County-Wide. I'm Brad Miller, and I'm happy to welcome for the second of two parts Malena Peraza and Dr. Kreuger. Malena with the Alzheimer's Association, the Desert Southwest chapter. Dr. Kreuger, a doctor at the Verde Valley Medical Center, working in Cottonwood and the Verde Valley area, working in geriatric medicine, talking with dementia patients and their families. And again, we thank the two of you for the great work that you did. In our second piece, we talked about holiday stresses for caregivers and stresses in general for caregivers. We're going to talk a little bit more, focus a bit on the family dynamic. A lot of times there's the caregiver and there's the patient, and it ends right there. But more often there's additional family. There are siblings. There are there could be siblings to the patient and so on. There could be children, obviously, adult children and little kids with their concerns. Even neighbors, coworkers, and friends, whomever is in your social circle may have something to say about how things are working. So I wanted to focus on that a little bit in this program. But first, let's back up to the most recent walk. Mm-hmm. We always chat. We have you come in every year, and I'm thrilled to do it, to put some publicity and a bit of a spotlight on one of the many events that the association does. But the recent one really seemed to kind of reach for the stars.
Oh, my goodness. And let me tell you, this is just a testimony to the wonderful supporters and community that we have. So each year, every walk has a specific monetary goal of what we want to reach. This year, our goal was $88,000. So needless to say, in the past couple of years, the goal has exceeded that. But we, as a community, raised over $146,000,
wow,
attaining 166% of our goal.
That's great.
And it was mentioned in our national town hall with the association that went across the board for the United States, and we were one of the top walks in the country percentage-wise.
That's incredible. And that's why. What do you attribute that success to?
Well, Dr. Kreuger is an example of many champions that come to support and raise funds that are dedicated, that have patience and or connection with the disease, but it's also sponsors and businesses that are connected and have a definite connection with the wonderful work that we do, and they get it. And there's definitely that need, since we are still, again, as mentioned in one of your shows, the #1 state in the country with the highest reported cases.
I've got to let Dr. Kreuger in here. His head's about to explode. He's pointing at you. He's pointing at you. There's some thanks to be given to this lady sitting right next to you and her work at the association.
No, absolutely. Despite her obvious and heartfelt modesty, I think the reality is that a great amount of success of this walk was due to Malena. And
oh, you're so sweet.
Really. And,
well, that's great. I mean, it's just, it's a team. It's an effort by everybody involved, you folks and beyond. Doctor, your patients and their families and whomever else just takes part. Yeah. And becomes a part of this, and we'll have you in next time that there's a walk, so that people can understand what it is and how it doesn't help them today. It may in the future. But let's talk then about the what we kind of described initially as the family. It's not just the caregiver who's going to be making decisions or have the most concern about a dementia patient. It can be adult children, it can be grandchildren, it can be, you've seen it all. How does it work? I think there's this kind of thought from the outside that, well, it's all going to be one team helping to make the decisions, and we're all going to have a common idea or common ground in how we're going to do that and where mom should be at certain time or where grandpa should be and those kinds of things. And the two of you are sitting here shaking your head saying, no, it's not always that easy. And of course it's not. Families are families. And there's going to be baggage from the past coming in, and those decisions might be tougher than it seems like they should be.
It's true. We always hope that people come together with these big family decisions that are always together on the same page, but the reality is it's not. Family dynamics come into play, and especially when things get emotional, tension happens, it's just a high emotional time, and it's a very serious discussion when you have to sit down and talk with your other siblings about mom or dad or whoever it is that is impacted. There's a sense of denial, acceptance, and Some people, just based off of their own perception of, you know what, we really need to deal with this, are on board and want to take the next steps, where some siblings, and personal experience, one myself included, I had one brother that was on board and one that wasn't, and it took some convincing, and it took time for him to identify that there's something going on with mom.
Yeah. You kind of shared a story off mic that I'd like you to share again, if you would, where someone, because you were kind of wearing the colors, if you will, you had a medallion or something that identified you as being with the Alzheimer's Association.
Right.
You were approached by someone who at that time was a stranger.
Right, as I'm wearing now, purple. Purple is our color. I had my tag on, and I was at a big store, and I had no idea that I had my my association badge on. And he just said, I think there's something going on with my mom. And
just another customer in the store.
Just another customer in the store. And, it was just by chance coincidence. But in a nutshell, the decision was made that him and his person's siblings had to have a conversation about the parent. And it was hard because one of the siblings was not in belief that perhaps there was something wrong with the parent, that they could have dementia. And that also, the person was very, very upset about it. And I immediately just said, the biggest thing that we can do, and you can do for yourself, is call this 800 number, right. Talk with somebody that will lead you, have those emotions recognized, tell them what you're going through, tell them exactly what you're going through. And these are master trained clinicians that will help guide them along the way. And then based off wherever a person lives, they will get that information and find the resources, the next steps where they can go and talk with somebody. But it's just the first process of calling that 800 number.
Well, there you go. And it's such a great illustration, because here's a guy who knew in his heart already that he needed to reach out. He knew that he probably knew, if I Google, I'm going to find something, but he couldn't make that step. And then he saw you, and that's what kind of did it for him. And it sounds like his entire family.
Right.
And that's what we would stress to the folks that are in this situation now. Malena can't be everywhere in every store all through the holiday season wearing her purple and her badge. Make that call. Do what you can. Do what you need to do. Dr. Kreuger, there's an old saying about if you think you drink too much, you probably do. Mm-hmm. If you think mom or dad might have a problem, does that same thing apply?
It absolutely does.
At least bears investigation.
It certainly does. And, you're talking about the family dynamics, and what often happens in my office, someone will come in and say, my fill in the blank. My brother and I cannot agree. My brother and I cannot agree on what to do about mom. What do you think? And what I say to myself is, that is the most expected thing I hear. We hear it all the time.
They think their situation's unique.
They think it's unique, but it's more often than not, that's what happens. I mean, think of the stresses and challenges of growing up with a sibling. Why would you necessarily think you would agree with your sibling on anything?
Sure.
And stressful situations, despite what you might hope for, don't always bring about the best. One of the things that we as physicians can do is, since we have a little bit of respect in this world, we can help to facilitate those kind of discussions. Yeah. By educating family members when appropriate, and then trying to understand the dynamic inter-family challenges. That's one of the things that we do. I often say to patients, we can be the bad guys. We can be the person that says to someone, I don't think you're really safe to drive anymore.
Right.
We're happy to do that.
Oh, God, that's a tough one.
We are happy to do that. Not happy to do that, but we are certainly willing to do that. We're happy to do it. But as far as, your other question, when is it an appropriate time? And I guess when you're starting to think that it's time, it's probably time. And that point really can be different for everybody. As a common example, for a lot of people, when the patient is incontinent, for a lot of people that's sort of the critical mass time to change. For other family members, it might be just inappropriate, angry, accusatory conversations from somebody. So it really depends. It depends on the caregiver's comfort with the situation, and their ability to handle it in an appropriate way. And we and Malena, we're obviously there as resources to help when that time comes.
And it may not be a marked difference. It may be more nuanced than that, especially if you visit, you have access to the patient daily or weekly or commonly.
You make a great point. And earlier in this discussion, you talked about someone who visits once a year.
Yeah.
You see someone once a year or every 6 months, you can see the differences. They're really obvious. If you use someone every day, not so much. Right. From one day to the next, they're probably not going to be very different.
Right. Okay. That's the time to make that phone
Absolutely.
call. Call Dr. Kreuger's office. Contact the association. They have professional people, very well trained and disciplined in how to get you to the help that you need. Continuing our conversation after our short break, talking especially about caregivers and now the family dynamic. Everybody can become a caregiver at some point with a dementia patient. Dr. Corey Kreuger, Malena Peraza, our guest. I'm Brad Miller. Countywide is back right after this.
Life changes, then it changes again. Predicting the unexpected in life is impossible. That's why it's called unexpected. So when it comes to financial goals, our philosophy is don't predict, prepare. Hi, I'm Edward Jones financial advisor Matthias Sandoval. A job loss, change in health, or a loss of a loved one can have a big impact on your family's financial security. Let's work together to help make sure you're equipped for life's unexpected events. Call our office to schedule a face-to-face appointment.
Edward Jones, making sense of investing. Member SIPC.
Verde Solaire, your hometown heating, air conditioning, and plumbing company in the Verde Valley, and your trusted North Central Arizona Goodman dealer. Goodman is a name you can trust with the revolutionary Comfort Bridge technology factory installed into select Goodman gas furnaces and air handlers to ensure the entire system operates at peak energy efficient performance. Verde Solaire offers free in-home estimates, locally owned and operated since 1983. Visit them at verdesolaire.com. Better, cleaner, faster.
Thank you so very much for your generosity and kindness in helping others. I hope that you take advantage of the many Arizona state tax credits available when giving to qualified charities and schools. If you haven't taken advantage, I hope you'll ask your favorite charity if they qualify. You can go to Arizona Department of Revenue website, search for tax credits, and look at the list of qualifying charities. Then look at your latest Arizona income tax return and see how an Arizona tax credit can benefit many. This is Lewis saying thanks again.
Let's talk. That's the message from Jonna Randall Murdoch, your local Farm Bureau agent, providing a personal touch when making insurance and financial decisions. Jonna will simplify your insurance needs while offering competitive pricing. Let's talk auto, home, life, and farm. Call Jonna at Farm Bureau today at 928-649-8686. Your Cottonwood Farm Bureau property and casualty insurance company. At Farm Bureau, they insure more than just farms.
Welcome back to the program. Brad Miller with you, Malena Peraza and Dr. Corey Kreuger, and we thank you for being with us today. Money, financial. This can become an expensive thing. I don't think we've touched on that at all. So there are so many dynamics, and Malena, you started to say there's an emotional element. There's
an emotional element. Definitely, there's a psychological. There are just the human level that comes into play when you're talking about stepping up and wanting to be a caregiver. But what also is part of that, and we didn't talk about that, is the financial component that is part of the caregiver.
Can be the biggest piece of this.
It is. When you think about it, you've got to take mom to her doctor's appointments. You have prescriptions to fill. You've got so many things that go along with the daily tasks of the finances, caring, feeding. There's so many different components that we don't take into account that need to be addressed. And I'm kind of jumping up a little bit here, but if somebody is diagnosed with Alzheimer's or a form of dementia, their behavior, it's going to progress. The stages will increase depending on the individual, depending on how many years before that next stage. But here's what will happen is that finances through a parent, whatever assets they have, that is another serious conversation that needs to be considered when taking care of somebody. Who's going to make those decisions? Where are they going to go? And the sooner those conversations can happen, well, that person is still somewhat cognizant, the better it is for everybody. But that's the other side of the financial topic. But while you're going through it, yes, it impacts the caregiver financially as well.
Wow. It can be overwhelming. As I sit and I listen to the two of you, but that's why you do the work that you do, and that's why we're doing this radio show, because we know there are people that are hearing this program that are in that pool of being overwhelmed right now, or perhaps during the holiday season as we move through that, a kind of will be. Something I want to ask Dr. Kreuger, when does it become time? there's going to be, as likely as not, a point where mom or dad they cannot be cared for in the home anymore. They are perhaps going to need a facility, an inpatient. Something is going to happen. Is that typical, or am I kind of barking up the wrong tree here? Isn't it fairly certain that at some point, I'm thinking of the Glenn Campbell story. It was very famous. At one point, his wife very cheerfully, publicly said, "I can't do it anymore," and it helped. I think a lot of people understand this disease.
Mm-hmm. I think it's fair to say it's different for everybody.
Of course,
like anything else.
Of course.
This has actually been studied. The critical juncture for many is when the patient becomes incontinent. Okay. Changing diapers for family members and caregivers is something that they can't or don't want to do.
Right.
And that's often the critical change. But it's really more than that. It's when the physical and psychological challenges despite appropriate help, become overwhelming.
Yeah.
That is the time. And as one's physician, we can help you determine when that is. I think it's one of those times when you think it's time, it's probably time.
Yeah.
In fact, in my practice, it's probably past time because of what we said earlier about people often being unrealistic in their ability to care for someone who needs a lot of help.
Right.
Unfortunately.
We've kind of come full circle to our original piece of this 2-piece segment.
Yes. Wherein
so much of what's going to happen is going to be decided by the caregiver, for better and for worse.
Mm-hmm.
And that just puts all those pressures at an extraordinary volume to have to know you're going to make a decision that really is going to certainly end one portion of someone's life, and hopefully it will improve as best it can the situation, by handing off to people who are trained in an on-site facility.
And, to follow up on something that Malena said, the financial challenges of caring for someone, it is not commonly known, and I get asked about this all the time, so I'm sure it's not commonly known. Assisted living facilities are not covered by Medicare. They simply are not.
Mm-hmm.
Like anything else in the world, there are different qualities of facilities. If you share a room with somebody, that would be less expensive than,
Right.
obviously a very luxurious facility. And, fortunately in Cottonwood, there are choices: Cottonwood, Sedona, Cornville, etc. That being said, it can be financially challenging
Right.
to have someone placed in one of those facilities. The reality, however, and not sure this is good news, but, as a physician, I can sometimes give a rough estimate of what life expectancy is going to be. You're not going to probably be paying for 10 years of assisted living care. That's not likely to happen.
Right.
And hopefully family members that have the financial resources can get together and decide what's the most appropriate approach to take to make sure that those financial demands are taken care of appropriately.
And that gets
not always easy.
That gets difficult too. It's not just about who's got how much in what account. There could be dramatic differences, say, between siblings.
Mm-hmm.
There can be, this one has 0 children, this one's got 5. There can be, these kids are college age, and just every kind of scenario that you can paint comes into play. And that's why we can't just say, do this now and bang, you're done. Everybody is going to be different. Every patient, every caregiver, and
Right.
so on.
They're all unique.
Every one of them is unique. And that's what the association comes in and tries to help with, is helping you sort out what needs to get out of the way so you can see more clearly what you need to do.
Absolutely. And I think, too, because the holidays present a different level and a heightened level of stress, that 800 number that we've shared, it can be reached 24/7 in over 200 languages. So even if you, whatever time of day it is, call the number. They are wonderful, and we want to, again, help as best we can during this holiday time, but every day.
Yeah,
Not
just now. We focus now because people are getting together, and some of these things might come to bear. As we go to break, why don't you give that 800 number again? We'll come back. We'll talk a bit more about how folks can reach out.
That is 800-272-3900.
One more time.
800-272-3900.
I'm doing it radiothon style here. It's important for folks to understand that. Let's take a short break. We'll be back to Countywide right after this.
Life changes, then it changes again. Predicting the unexpected in life is impossible. That's why it's called unexpected. So when it comes to financial goals, our philosophy is don't predict, prepare. Hi, I'm Edward Jones financial advisor Matthias Sandoval. A job loss, change in health, or a loss of a loved one can have a big impact on your family's financial security. Let's work together to help make sure you're equipped for life's unexpected events. Call our office to schedule a face-to-face appointment.
Edward Jones, making sense of investing. Member SIPC.
Verde Solaire, your hometown heating, air conditioning, and plumbing company in the Verde Valley, and your trusted North Central Arizona Goodman dealer. Goodman is a name you can trust with the revolutionary Comfort Bridge technology factory installed into select Goodman gas furnaces and air handlers to ensure the entire system operates at peak energy efficient performance. Verde Solaire offers free in-home estimates, locally owned and operated since 1983. Visit them at verdesolaire.com. Better, cleaner, faster.
Thank you so very much for your generosity and kindness in helping others. I hope that you take advantage of the many Arizona state tax credits available when giving to qualified charities and schools. If you haven't taken advantage, I hope you'll ask your favorite charity if they qualify. You can go to Arizona Department of Revenue website, search for tax credits, and look at the list of qualifying charities. Then look at your latest Arizona income tax return and see how an Arizona tax credit can benefit many. This is Lewis saying thanks again.
Let's talk. That's the message from Jonna Randall Murdoch, your local Farm Bureau agent, providing a personal touch when making insurance and financial decisions. Jonna will simplify your insurance needs while offering competitive pricing. Let's talk auto, home, life, and farm. Call Jonna at Farm Bureau today at 928-649-8686. Your Cottonwood Farm Bureau Property and Casualty Insurance Company. At Farm Bureau, they insure more than just farms.
We welcome you back to the program. It is Countywide. I'm Brad Miller. Dr. Corey Kreuger is here, Malena Peraza, and we're talking about dementia, patients, caregivers, families, so many different dynamics. We could probably do a third part on this and still not have all the answers for everybody, and everybody understands that's in this room right now, and we hope that our listeners do as well. That's why the Alzheimer's Association, the Desert Southwest chapter, does what they do, and as we heard at the top of the show with the October Walk, doing very, very well. So again, congratulations. If folks are interested in next year's walk, comes in October, so it's a ways out, but they want to be a part of this, can they find information for 2025?
Absolutely. Well, I kind of want to mention 2024 too.
Okay.
We still are accepting donations at the end of this month. So December 31st will be applied to this year's walk. And that walk website is alz.org/Verde Valley Walk. And that website will, once January 2nd rolls around, we'll take them to our 2025 information and our new walk, which will be October the 18th on Main Street.
Okay, terrific. Wonderful. One more time, let's have that phone number and that information.
Absolutely,
so people
Brad.
can reach out.
It's 800-272-3900, and our website is alz.org.
All right. Dr. Kreuger, Malena Peraza, thank you so much again for the work that you do, for sharing your time with us during this busy season. I'm Brad Miller. It's Countywide. We'll see you next time.
This has been Countywide. Listen in each Tuesday and Thursday at this time. If you have a topic or guest idea that you'd like to suggest, email us, news@myradioplace.com.